Growing questions about government transparency today after the revelation that Defense Secretary Lloyd Austin has prostate cancer. Secretary Austin was diagnosed in early December, but the diagnosis was not shared with the White House until yesterday morning. The secretary has been hospitalized for more than a week due to complications from a procedure to treat that cancer. NBC News senior White House correspondent Kelly O'Donnell joins us now. So, Kelly, we just heard from National Security Council spokesman John Kirby within the last hour. What exactly did he say about all this criticism?
Well, there are persistent questions and a real curiosity on the part of the public, and certainly journalists are forcing those questions on the White House about why Secretary Austin did not disclose directly to the president and the White House the nature of his diagnosis in December. Several weeks went by from his initial diagnosis, had his initial procedure, which included full surgery and being put under anesthesia, and then ultimately we now know how this has played out. John Kirby, who speaks on behalf of the National Security Council, was asked about this when pressed on had the White House tried to find out what was wrong with the secretary.
I can assure you that that throughout every step of the way, from the time we were notified until, yesterday when we all found out that he had prostate cancer, there was no lack of curiosity on our part, no lack of, or slackening of an effort to try to find out what was wrong with him.
And what gets to the heart of this, of course, are now two ongoing reviews, one at the Pentagon, another coming from the White House Chief of Staff to the Executive Office of the President and to the key cabinet officials to just restate what in some respects many people would think is a judgment call that should have been upfront and obvious, that top-level leaders, while they have personal concerns and health matters at times, when you're in the cabinet or when you're serving in government at a high level, there are expectations about disclosure. And that's really what will be going forward here, that there were days where the president was uninformed about the secretary's medical condition and lots of questions about how that should have been handled differently. So there'll be more to come as these reviews go forward. Zinkley?
Thanks for watching. Stay updated about breaking news and top stories on the NBC News app or follow us on social media.